Good evening, everybody. On behalf of my team in Bangalore, a very interesting and a different topic. Already heard in our earlier session, I'm going to carry you through a journey of sustaining Homoeopathic Community Health Worker program to carry through preventive, curative and mobilization work in the community, the ways and the means. In the journey of a physician from the compartments of an air-conditioned private practice to a public domain will require us to understand the terrain. What are the issues that we face when we reach to a community? It's not relevant whether the community is just very poor economically, because the community is a group of people who have a similar custom. So what are the challenges that we faced in our terrain? We had early marriages, 16 years, 14 years. We had alcoholism because most of the men drink there. We had gambling. We had issues of castes because India is very socially divided into many caste systems. And we had domestic violences, and the women were always on the weaker sex side. In all this, in a very turbulent setup, who is going to help us through this journey being a homeopath? The community health worker was our change agent. As mentioned earlier, she is a 7th pass, and she's selected from the community and trained by the homeopaths. What would be the challenges that you face when you train this worker? You have somebody who has a poor self-esteem. She is not going to be given the freedom to work for you because she is a female. She has other roles to play. The society has to accept her in the role of a worker, and she has constraints of being economically poor, and she will ask you for sustenance. Can we sustain this program? What will be the processes that we need to look into if we need to do this? So the objectives of our training program as a homeopath who is a facilitator and who has made the journey into this public health will be to create a platform to showcase the identity of a community health worker, and that too a homeopathic one, to advocate for health behavior change in the community. We need to create opportunities for her to be empowered and self-sufficient, and we need to create a transparent flow to sustain them. Why is she important? She is the bridge between us and the government, the schools, the community, the NGOs, and our organization. So you can understand the homeopath who's going to play a facilitating role will have to see that he addresses for this one particular worker issues of health, hygiene and sanitation, which we call as preventive methods, diet and nutrition, cultural factors and social milieu, and not forgetting our homeopathic system of medicine. So the focus of training ensured that the community health worker was carried through all these areas of preventive, promotive and curative means. We would like to demonstrate a few case studies of our community health worker who has been trained in this particular manner to demonstrate the sustainability process. Let's begin with the first case. Asha, a shy, introvert orphan, was able to consult the homeopathic physician and start treatment for a primary gravidia with delayed labor pains. All of us know many remedies for delayed labor pains. Asha was able to get in touch with the physician who's 30 kilometers away, start the medicine. Was that enough? Asha also required this lady to be transported to the nearest hospital. She had to coordinate with an ambulance. She had to take the support of her family to ensure that this process gets completed. So it was not just the medicine, and you can see in our setups, we are so easily accessible to our nursing homes and this. In this setup, which is 30 kilometers, is the first hospital away. Asha accompanies this pregnant lady to ensure that the delivery does not take place on the way in a wrong manner. What helped Asha, an orphan with a very poor self-esteem, do this? It was the training program, enrolling her family who'd never believed that Asha could be capable of this, nurturing her self-esteem. And as you could see, Asha attended the class with her 2-year-old son. She got rid of her self-doubt and her shyness, and today Asha is in charge of 5 villages as a community health worker, and she ensures that nobody in her village suffers because of health problems. Let's take the case of Surekha. Very interesting. 70-year-old in the night. There's no medical help in the village. The nearest one is 15 kilometers away. Develops severe abdominal pains. What would our community worker do? She realized that this patient was not having a normal acute abdomen. This was much more intense and severe. The patient was getting cold. She measured the pulse of the patient and she realized it was dropping. Will this be able to manage only in the village? Surekha took the decision of moving the patient to the nearest hospital. She immediately got in touch with our physician and explained to him what was happening. She spoke to the allopathic doctor who was convinced patient needs a surgery. Surekha was able to understand the pain is on the right side and there must be some organ of appendix there which may be possible to treat with homeopathy. She asked time from the doctor, let me talk to my physician and give this patient medicine and do not do the surgery in an emergency and give us some time. You can imagine one more point. The allopathic doctor was very keen that the patient will get into complications. Surekha was able to stand up and tell, no sir, she does not have guarding. She's not yet gone into a state of shock. Can we please wait till my physician comes and sees her? What do you think is the outcome? Patient was hospitalized, given homeopathic medicines. In case you need to know, it was Iris 10X. Patient recovered in 3 days' time. Surekha convinced the hospitals that it is possible for us to treat patients with homeopathy. And this Surekha was able to not only motivate the patient, but an entire village to take homeopathy. So this was what Surekha did. And what helped Surekha was, she was trained in an integrated manner in understanding signs and symptoms, health and disease. She had the support of the homeopathic physician, and she had a great degree of self-belief and confidence. Let's take another case. Pramila, our community health worker, saw that Sakama tribe met all criteria for protein, energy, malnutrition. What she did was, she organized with an NGO for the food and milk supply, her knowledge of PEM, faith in teachers, and using the physician as resources to give medicines to these children. Pramila was able to ensure that these children came out of the PEM. What was the 4th step we needed to do? We needed to make these community workers independent. Should we make them perpetual providers or should we make them self-sufficient? The doctors created an innovative way of providing inventory and processes for manufacturing. The worker invested the initial capital from their stipend. They marketed and sold the product. And as a result, today our community health worker with the Sutra ointment becomes economically independent, got a name in the community, aided in sustaining a project. and she earns 2,000 rupees a month today. What helped? The entrepreneurial mindset that we developed in this worker, the struggle to serve, the struggle to grow and become independent, and the struggle to make a difference through socially relevant measures. What has helped in this process is inclusion, enhancing motivation and establishing identities, bolstering self-esteem, be sensitive to their needs and difficulties, and play a role and help them in playing roles so that they prioritize their times and manage their time well, and establish economic independence through self-help groups. Mind you, it was the homeopathic physician who played the facilitating role in all these processes that led to the positive behavior change in holistic care. What has been the impact? We have covered with 2 medical officers and 1 training program. We have covered 6 panchayats, over 1,000 houses, 10,000 population. You can see the divide. You can imagine the impact how 9 community health workers trained by just 1 physician, and in a village setup where we have only 2 medical officers going, this has been the impact. Conclusions: the community health workers are vital for taking messages of health, hygiene and homeopathy to the masses. They need to be trained, mentored, encouraged and supported to emerge from their restrictive mindsets. Their entrepreneurial skills will assist them in their seeking stability and sustenance. I would just like to thank all my mentors at Bombay who helped us in this process, and I would just like to share a small thought. Very few people have dreams that made organizations, nations and countries. Martin Luther King, Gandhiji were one such. We also had the dream through our Sir M.L. Dawle of carrying forward his vision of the first public health initiative in homeopathy. And today we are paying the fruits of this. Thank you so much for your patient listening. Thank you.
Thank you.